The impacts on food availability and nutritional quality will in turn result in a lot of health implications and an increased number of people at risk of hunger, malnutrition, and diet-related mortality. We also need to consider the ways in which food production and food supply chains contribute to the climate crisis, so the other way around as well. A 2019 IPCC report captured that approximately 22% total net GHG emissions come from agriculture, yet mitigation policy remains limited for agriculture and feedstocks. So there are proposed solutions and approaches to consider that we'll discuss today in the session, and we'll go over how that relates to the nexus in the next few moments. So I also just want to acknowledge that I've been walking around the Blue Zone and I've seen a lot of different sessions related to food security and how climate impacts food security, which is great. I think what our session brings that's a little bit different is the health implications across that nexus from rural to urban, and we also have some case studies that we'll bring into practice that you'll hear from our presenters, as well as global research that touches upon this nexus. So that's what you'll hear from us today. So now we'll start with our presenters. Our first presenter is Dr. Walid Salam, who's online, and he'll share his screen for his presentation. Dr. Walid Salam is the chief party of Feed the Future Egypt Rural Agribusiness Strengthening Project with Apt Associates, and holds a PhD in agribusiness marketing and agro-food products from Valencia University. So over to you, Walid.
Good morning, everyone. First of all, I would like to let you know that over the last 4 years, we have covered about 75 smallholder farmers in all over Egypt. And the definition of smallholder farmers for us, farmers who own 10 acres or less than 10 acres. We work with them in the Upper Egypt region, from Bani Suef, as you see in the map, from Bani Suef till Aswan, and in addition to the Delta region, including 7 governorates, including Alexandria, Gharbiya, Sharqiya, Daqahliya, Menoufiya, Ismailia, and Beheira, in addition to Greater Cairo, including Cairo, Giza, and Qalyubiyya. I would like to mention that Egypt has faced severe changes in climate patterns in the last few years. This including, but not limited to, more extreme temperatures, both increases and decreases, and the fluctuation between temperature along the same day. Changing rainfall pattern with an overall decrease in rainfall, but some more severe rainfall events. Changing wind and storm patterns with increased intensity in many cases. This resulting in negative impact or environmental impact, such as strained water resources, especially in the Delta region, presence of pests and diseases in both regions, in Upper Egypt and Delta, and shorter and sometimes longer growing season because of the decrease and increase of temperatures, and this makes farmers lose their market opportunities, market windows, and in many cases their comparative advantage. This resulting in dramatic decrease in smallholder farmers' yields, both in terms of quality and quantity. Since smallholder farmers have limited financial resources and limited access to finance, APP provided on-time, what is called on-time, no-cost, low-cost technologies and the practices that promote climate adaptation, mitigation, and resilience in order to minimize the implication of those climate features through field visits, SMS, and remote technical assistance, including SMS messages, WhatsApp groups, WhatsApp messages, WhatsApp photos, phone calls, and Facebook posts. APP's climate resilience activities focus on encouraging better agricultural production practices, such as improving water management, since conserving water use is vital, particularly in times of high temperature storms and low temperatures. Controlled irrigation reduces those damages. One other better agricultural production practice is strengthening soil fertility by increasing use of organic fertilizers such as compost, to increase soil fertility, reduce soil-borne diseases and infections by using soil disinfectants prior to planting, improve soil quality by adding soil amendments. One other better agricultural production practices is better planting practices by adjusting planting dates to minimize damaging effect of frost and low temperatures, encourage and to introduce the concept of crop rotation to reduce consistent fungal, nematode, and other infections, and apply practices that minimize damaging effect of high, low, and temperatures and winds and rains. One of these practices, like introducing salicylic acid as a source of aspirin to smallholder farmers in order to provide plants with this. This increases the immunity of plants, resulting in an increased production by at least 40 to 50%, depends on the crop or the value chain, decreased cost by 20 to 25%, decreased chemicals use by 40%, decreased water consumption by at least 30%, increase in net income by 40 to 50%, and therefore increase and improve the livelihood of these smallholder farmers, and decrease post-harvest losses by 30 to 40%. Thank you very much. Over to you, Amanda.
Thank you, Walid. It's really interesting to hear of a project here in Egypt where we all are in the room, to hear about how smallholder farmers and agribusinesses are adapting to climate change, but also the health implications that they've seen in the project to date. It's very interesting. So thank you so much, Walid, for presenting. Our next speaker is Susanna Mayhew, who's going to be sharing her screens online. Susanna Mayhew is a professor in the Department of Global Health and Development at the London School of Hygiene and Tropical Medicine, and is working on cross-sector community-led responses to climate shocks that affect health. So over to you, Susanna.
Thanks, Amanda. So I'm sharing findings from baseline work we did to inform integrated programming in rural districts in Ruchiga, Uganda. And the programs are implemented by the partners you see on this slide. And the findings are from 40 interviews, 28 focus group discussions that we held in 8 communities there to understand the interconnections between these different challenges that they are facing. And respondents recognized clear sets of interconnections, particularly around these two, sorry, it's a bit busy, these two pathways here. The first, around changing climatic conditions, especially rainfall patterns, which are unpredictable now, combined with poor farming practices and degraded environments, which contribute to soil erosion and flooding that regularly destroyed crops, leading to poor nutrition and health. And then the second pathway here, around a demographic connection, in which people saw that high fertility meant ever decreasing amounts of land to farm, which again leads to insufficient food, poverty, and as an unexpected finding, an increase in domestic violence, putting women at greater risk of unintended pregnancies, which was then further compounded by the fact that they had poor access to family planning and other healthcare services. Now, these pathways from the previous slide affect all 4 pillars of food security seen in the yellow boxes here, through climatic factors, which cannot be changed locally, but also through a series of anthropogenic factors, which can be dealt with locally. And 2 sets here. First, anthropogenic actions that include environmentally damaging practices like burning trees, unsustainable farming practices. But these are also driven by other kinds of anthropogenic factors leading around increasing population growth, poor nutrition awareness, poor feeding practices, and the lack of access to family planning, as I've mentioned. Now, all these anthropogenic factors can be addressed through integrated programs, and that's what we're doing in the Ruchiga districts in the programs that the partners are supporting. So this slide, rather busy, but it shows an analysis that we did using the DIPSIA framework to identify program interventions. And the main message is that our understanding of the pathway connections and the impacts on food security allowed us then to pinpoint actions to address the drivers, pressures, the states, the impacts. For example, through supporting environmentally sustainable agriculture and livelihoods practices, and also to improve the health-related issues, access to and quality of contraceptives and other nutritional and health services. So the concluding message really of this work was that to build adaptation resilience to food security programs in remote rural populations like this, programs really must be intersectoral to address the full range of interconnected factors that impact food security. And we need different and better funding streams in order to help support this kind of integrated programming initiative. Thank you. Thank
you, Susanna. This is a great example of an integrated program that addresses the nexus in full, where you're seeing benefits not just to food security, but also benefits to health and adaptation practices, which is really great. Our next speaker is in the room, Patricia. Thank you so much. So if we can get first slides, please. Patricia Nyinguro is a climate scientist looking at subseasonal to seasonal forecasting with the Global Challenges Research Fund, and African Science for Weather Information and Forecasting Techniques, and is an IPCC focal point for Kenya. So thank you so much for being here.
Thank you. I'll be looking at how we build resilience from a climate services perspective and supporting communities in improving the food production and also coping with the vagaries of health as climate continues to change. Next slide, please. So this is the case for many developing nations where we have a high percentage of rural to urban migration, and projections show that by 2050 the migration will increase by about 60%. And this has implications on, for example, the workforce, and farming mainly is done in the rural parts of most of our countries. And so when we have more people moving into the urban areas, then there is implications on food production. And this migration also leads to urban stress on urban services. So most of these people who come to informal settlements and unplanned areas, and therefore the services that they're able to get are not as optimum as would be ideal. And for example, heat becomes an issue that we start facing in informal settlements compared to what is seen in rural regions. And also the science has shown that climate extremes are exacerbating the food and health crisis in many developing countries. The Great Horn of Africa region currently is undergoing a drought, a really severe drought, the worst we've had in 40 years. And this has impacts on food production. And then we have also flooding. And in cities, big cities such as Nairobi, Kisumu, and Mombasa, which are big cities in Kenya, we are facing heat waves. So for the longest time, heat waves have not been something that African nations have really been focusing on. But as climate continues to change, this is now a challenge that we are facing. And then food prices are increasingly becoming higher and production is also lower. So next slide, please. So how do we help our communities to build resilience in the face of such crisis? So one thing we do is providing early warning. With the Daraja initiative, so Daraja is a Swahili word for bridges, and what we are doing is trying to bridge the gap between the provision of climate information and making it more useful to the communities. So what we've been doing in the Daraja initiative is providing climate information that is tailored to particular sets of people. So if in the informal settlements they face issues with heat during the dry seasons, we let them know what the thresholds of temperature will be and how this will affect them. And then they are able to make decisions. And with flooding as well, on a seasonal level, we provide information and they carry out activities that enable them, for example, to clear the drainages, and then they don't suffer from the effects of flooding. Another thing that we are doing is approaching building resilience from a multidisciplinary angle, because we realize we cannot do everything on our own as providers of climate information. So we work with the agencies and different parts of government that have the mandate to support these people who are in urban regions. And we've seen that this works better than if we are working in silos in enabling communities to build resilience. We're also trying to push for transformational adaptation, which for us is will probably be something that will be done in the long term, addressing the underlying vulnerabilities, so poverty and governance issues. And this is something that we're starting to work on based on the information coming out of the IPCC Working Group 2 report. And finally, something that we're also doing in our region is safeguarding the entire value chain of, for example, food production. So we may have regions that are able to produce food to feed the entire country, but if we have extreme flooding, then vehicles are not able to move and transport the food to where it's really needed. So safeguarding the entire value chain from climate stressors enables us to be able to still serve the community and enable them to reduce vulnerability and build their resilience. Thank you.
Thank you so much, Patricia. I think it's also great that early warning systems in the health space have also been very critical for health decision making, to also understand how climate risks could impact health decisions in the health sector, but also in this space it would be really interesting if Daraja extended that to also include the health decision makers in Kenya. So it would be really interesting when we talk in the discussion if you can speak a bit more about that. So we're transitioning to our final presenter online, who's Marco Springman. And now we're transitioning also to global research. So we've covered our case studies already, and now we're moving on to some global research that our final presenters will talk about and how they impact policy. So Marco Springman is a professor at LSHTM in climate change, food systems, and health, and is the co-director of the Center of Climate Change and Planetary Health at the school. So over to you, Marco.
Yeah, thanks a lot, and good morning, everybody. So I hope you can see my screen.
Yes, we see it.
What I want to briefly touch upon is basically the other side of the coin, not the connection of environment to health, but the connection from food systems on both the environment and health, which is also an important impact pathway for all places, really. As a top level impacts to keep in mind is that the current food system is really woefully unsustainable. It's a major driver of climate change, with about a third of all greenhouse gas emissions attributed to it. It's a major driver of land use change and biodiversity loss, with 40% of the Earth's surface used for agriculture. It's a major user of freshwater resources, with 70% of global freshwater withdrawals. And we earlier heard some ways to improve this. And it's also a major polluter of terrestrial and aquatic systems through fertilizer runoff that already have created quite a lot of dead zones in oceans where no fish can live. So one can easily say the food system is a major driver of planetary impacts. We estimated that if we don't change course, we are at risk of exceeding all kinds of planetary boundaries that define the safe operating space for humanity. And that includes climate change related to greenhouse gas emission, land use change related to biodiversity loss, and blue water use that is related to freshwater extraction, and phosphorus and nitrogen application, which are related to fertilizer application. Fortunately, we also found that if we throw everything at the problem, then we can manage to stay within those planetary boundaries by 2050. But for that, we really need to do everything, and we need to do different things for different domains. For example, technological changes or changes at the farm level of the kinds that we heard for water management, for example, can be very beneficial and suitable to make a good contribution to staying within planetary boundaries when combined with other measures. And those other measures are better socioeconomic development, reductions in food loss and waste, and critically also dietary changes towards mostly predominantly plant-based and nutritionally balanced flexitarian diets. Especially when it comes to greenhouse gas emissions and climate change, we found that without those large-scale dietary changes, there is really little chance of avoiding dangerous levels of climate change. So I briefly want to touch upon the kinds of policies that are useful on that end. And I should also say, if we look at dietary risk that include both imbalanced composition of the kinds of foods that we eat and the overall scale of overeating or undereating, then on that, we estimated that about one in every 4 premature deaths is due to either eating the wrong stuff or eating too much or too little of food. So dietary changes towards more balanced diets can make a huge contribution in terms of reducing disease risk and mortality. In absolute numbers, that's about 10 million people every year die from eating poor diets. So what can we do to change this? Well, good housekeeping would be to reform national dietary guidelines, or just to have national dietary guidelines that take into account both the health and sustainability implications of diets. At the moment, we estimated that hardly any existing dietary guidelines, and not every country has those, is in line with global health and environmental targets, like the Paris Climate Agreement. Second, fiscal incentives can be very beneficial. And at the moment, if we buy food, we don't see the big price tags that our foods generate in terms of climate damages or in terms of cost of illnesses. If we were to integrate those, then unhealthy and unsustainable diets and foods that make up those diets would be relatively more expensive and provide an incentive to switch away from those. And the revenues from this pricing can be used to support low-income households and vulnerable populations. Third, most countries provide agricultural subsidies to their farmers, but those are very rarely linked to the producing the kinds of foods that would make up healthy and sustainable diets. So using agricultural subsidies and coupling those to a stronger degree to either beneficial ecosystem services or to the kinds of healthy and sustainable food commodities or groups of commodities that we need more of if everybody were to consume a healthy and sustainable diet. So here, basically, a better coupling to, for example, horticultural products would be really beneficial and result in changes in production, which would result in changes in relative prices, changes in consumption as a result, and which would then have also beneficial health impacts. We produced country-level results for all of those big picture studies that I mentioned here. So if you're interested, please have a look at those, and usually the country level results are available as supplementary information. Yeah, with that, I say thank you and looking forward to the discussion later.
Thank you, Marco. So thank you again also for bringing up the importance of sustainable diets and how that's also critical to building climate resilient food systems, and also the importance of food subsidies and how they can be used to protect them. So over to our final speaker that we have before we engage in a discussion, and it's Vivian, who's here in the room, and we'll need to put up her slides. So Vivian Maduke is a program coordinator for climate and health for the Global Alliance for the Future of Food, with expertise in sustainable food systems, global health, and international development. She also founded Food Systems Advisory, an advisory firm focused in Africa. So over to you, Vivian. Thank you so much.
Thank you very much. So I work for the Global Alliance for the Future of Food, and we are a strategic alliance of philanthropic foundations working together to transform food systems. And we do believe that food systems have to be integrated in climate action for us to achieve our societal goals, economic goals. And today we're talking about in the rural and in the urban areas. Next slide, please. Next slide. The previous speakers have talked about how climate change impacts food systems and food insecurity, and also how food systems affects climate change. So we all acknowledge that food systems is both a driver as well as a casualty. However, a lot of governments still do not take food systems seriously. We did a study and we just published a report. And if you look at the slide, one number or the two numbers that should stick in your head is 3% for 33%. What that means is, although food systems contribute 33% to the greenhouse gas emissions, only 3% of public finance goes to food systems. Now, that's a huge disconnect. And also what we found was that in addition to finance, many of the governments did not include food systems measures in their NDCs. And as we know, climate action is driven by the plans you put in place and the funding that everybody's asking for, loss and damage funding. Your funding comes from what is in your NDC. And if food systems, as important as it is not included in the NDC, then the financing will be an issue. So for governments and for many of us here who have government friends, please advise them to look through their NDCs and put in place food systems measures there, and also allocate adequate finance for food systems mitigation and adaptation. Next slide, please. If you look at the right here, one number that should also stick in your mind is 528 billion. Now, what does that mean? Even though we are asking for a greater amount of food systems finance, we also see that it's not just about the money, but about what the money is used for. A couple of people have mentioned subsidies. What we found from our study was that 528 billion, which is about 86% of the total amount going to agricultural production to date, has potential destructive effects on both our climate and our health. How is that? Majority of the funding goes to emission-intensive and unhealthy food products, such as sugar, such as beef. And it only advances the business as usual, right? The food products that are currently causing the damage. And also, if you look at these products, one of the things that characterizes urban food systems is ultra-processed foods. As we know, when economic crisis comes, people who are poor will likely go for cheap food. And I'm sure some of us are wondering, why is ultra-processed food cheaper than fruits and vegetables? And that's because the subsidies distort the pricing. It creates an incentive for private sector to continue to produce this product. And also, it makes unhealthy foods appear cheaper, but it's, in actual sense, it's not cheaper. It's because the subsidies are supporting the production. So for us to create that resilience in urban and rural food systems, the government needs to fix some of the structural issues. And one of the ways of doing this is to redirect the current public money going to unhealthy food systems towards production practices such as, you know, healthy foods, more plant-based fruits and vegetables, and also supporting agroecological practices. So it's all about the finance. So the three things I want us to take away from this meeting is, first, we need to acknowledge that food systems is one unit that intersects health and climate. And second, governments need to consider food systems in their NDCs because that's what determines what is funded. And the last thing is that finance is important, not just the amount of finance, but where the finance goes to. Next slide. So if you need more information on the report we just published, it's on our website, and I'm also available to provide more information. Thank you.
Thank you so much, Vivian. All right, so now we're opening it up for discussion. So have your questions ready, both online and in person. I want to introduce my final colleague who's on the screen, if we can go back to the Zoom, who's Pauline Schielbeck. She's the assistant professor at London School of Hygiene and Tropical Medicine in nutritional and environmental epidemiology, and she's going to be helping me co-lead this discussion right now. So over to you, Pauline, to start off the discussion, and then we'll take some questions from online and also in the room. Thank you so much.
Yeah, thank you very much, Amanda, and thanks to all the speakers. These were really interesting and inspiring presentations. Before I go, so there are already a few comments on the chat, but I was wondering to connect these talks a bit. We hear a lot about the areas where impact is most felt, and the many very creative and cross-sectional solutions that are put into place at the moment. And at the other side, we hear how much of a change we can make by global and also a lot of the global North food system transformations and more finance in that way. So there is quite a big mismatch between the places where the largest transformations have to be made and the areas where the impact is felt most. And I was wondering if the panelists would like to say something about is there the reason that this transformation is not happening at the speed that we would want to? Is that because this connectedness is not fully understood, or if this is much more driven by market mechanisms?
Anyone online or in the room want to take the first stab at it in our panel?
I think one important thing is that changes, food system transformations are not really much dealt with when it comes to public policy. I mean, that is just what we heard in the last contribution, that very often they don't form part of NDCs. And if they do so, then it's mostly agriculture as used as a carbon sink instead of proactive policy support that would go towards a food system transformation that also takes dietary changes seriously. So from my perspective, it's not necessarily a north-south divide there. It's a general lack of political attention on this problem.
I would argue on the policy front that it may also be something to do with siloing of sectors together, because in this nexus you're bringing health, agriculture, you're bringing people who are also working outside the agriculture industries and other sectors that also need to be coming together and have an understanding of the linkages, but not just the linkages, also how to spread that funding towards impacting all various types of impacts that we just discussed today. So that's also partially what comes to mind for me. Patricia or Vivian, do you have anything to add? Okay. Anyone else online that wants to contribute to the question?
I would like to contribute.
Yes, Waleed.
Yeah, I would like to say, yeah, there have been an integration among all value chain actors, including all actors, smallholder farmers. For example, we have to collect information about climate, analyze this information, transfer this information into farmers, and ask farmers to act against this information. So this system is absent right now. The idea is how to make all these actors working together. And it is not an easy task, at least in Egypt or countries in developing stage.
That's great. Thank you. Yes, Patricia.
I think also how we approach these conversations is very important.
Oh, sorry. Can we make her mic a bit louder?
Yeah, how we approach these conversations is important. For example, a large part of the Kenyan is arid and semi-arid, and we have a lot of pastoralists, and they depend on livestock rearing. Right. And if you look at the IPCC reports, a lot of emissions also come from unsustainable rearing of or bringing up of livestock. And so if we go in very forceful, then we kind of lose the goodwill from those who can really contribute to the conversation very well. So how we approach it is also very, very crucial. We would not, it would be useful to not just go with this is what the science says, this is what you immediately need to do, but how can we be able to help them transition towards more sustainable rearing of livestock and even changing their diets with support from climate information right. to enable them to diversify their livelihoods as well.
Right.
Yeah.
Thanks so much. All right. Do we have any questions in the room that I can start taking? And Pauline, maybe you can take one from online.
Yeah, sure. Are there any in the room at the moment?
Are there any questions in the room that I could take? Yes, I have one question in the room here. We'll pass the microphone. Can you pass the microphone?
Thank you. Thank you for this interesting discussion. I'm Santiago Enriquez from Abt Associates. So you talked a little bit about, or gave a number of examples about resilience sort of in the production, and then talked a little bit about consumption. But I wonder if you could talk a little bit about what's in the middle. Like, are there resilience opportunities, for instance, in terms of storage, in distribution, in other sort of aggregation channels to help sort of improve the resilience of the value chain? And to what extent are those sorts of options, you know, affordable for communities and maybe people who rely on subsistence farming? Thanks.
It's a great question. Does anyone from online in the panel have anything to add? Would like to take the question?
I could start out, yeah. So in Kenya, we're working on securing the entire value chain. And this is because, for example, maize is one of the staple crops that we grow. But if the storage is not done very well, then we have aflatoxin and we have a lot of other issues that eventually affect what is available for use. So by working with the various ministries within government and also development partners and other actors, we enable the communities to put into practice means of safeguarding the value chain. So the farmers would be helped to see what's the timing for harvesting that does not coincide with rainfall that eventually affects the storage. And then offloading of that product that has been harvested. How soon do you need to offload it, either to sell it or for your own subsistence use, so that it does not stay too long and then ends up getting wasted. And so the key here is working with various stakeholders who can be able to support the farmers at different levels so that they don't make losses and that they end up, they remain food secure. Yeah.
Does anyone online have anything to add?
Yeah. I'd like to also add to that. When each time we talk about the middle of the value chain, we always look at transport and storage. But also there's the marketing and the education, and that's what drives consumption. How do we educate people? How do we market? What kind of information and food environments are they placed in? I gave an example of the urban food system. Between production and consumption, that environment is the middle piece. Where are the fruits and vegetables? Are they located around them? What's the pricing? What's the marketing around them? Is ultra-processed food marketed as this glamorous food product? And is it cheaper? So that's also another middle of the value chain that needs to be considered, because as much as it's people's individual choice when it comes to consumption, their environment stimulates what choices they make.
Absolutely.
Yeah.
Anyone online?
Yeah, there are a few questions online.
Sorry, Pauline, just before you take another question,
sorry.
can I just quickly add to that one? Thanks.
Sorry, yeah.
Sorry, in terms of community resilience, I think the Ruchiga project that I was talking about found that where you were able to integrate programs to bring both men and women in, not only around sustainable livelihoods and more environmentally sustainable farming practices and so on, but also around the health issues which they saw as critical to their lives. Then you had better commitments to both the sustainability side of changing practice and the health side. So women were more involved in some of the sustainable agricultural practices and men were more involved in health. And collectively, they felt that the programs were addressing all of their needs and not just the siloed needs. And we talked about the silos earlier. And I think it is critical that funding starts to take that connection, those connections into account. Thank you.
Yeah. Good point, thank you.
So maybe that leads quite nicely to one of the questions online, because we've heard the buzzword multi-sectorial, and quite a number of times you talked about it, Susanna, and also Patricia, and it was touched upon in the other presentations as well. And so someone in the online asks, does the panel have some good examples of where it could be national or global experiences of where this sectoral interconnectedness is progressing well, and what we can learn from that?
Yeah. Great. Vivian in the room has something to add?
Yes, we have one example. So when we did the assessment of the NDCs for Kenya, what we found was that in the development of their NDCs, they were quite multi-sectoral. So they brought people from not just from the health sector, but also from the indigenous groups, people from rural areas, from urban areas. Because as you mentioned, the science is important, but also the social aspects are important as well. If you're going to bring in any policy, you need to include the various sectors, but also the various forms of people from rural and urban areas. So if you look at the assessment we did, Kenya is a great example of how you can integrate the various aspects of the food system to create a policy and a climate action plan. Thank you.
Do we have another example? from Kenya as well?
Yeah, so I was going to build on what she mentioned.
Yeah.
From the climate services perspective, when we produce information, what we've done is we try and sit with the local communities because they have their ways also of predicting the weather. And if we just go with the science, then the uptake is really low. So what we do is we provide what the forecast says, and they provide what they've seen from observing their systems, and then we harmonize the two.
Right.
And what we've found is that this enables them to trust first the climate information we give, and then we are able to plan along various sectors. So for food, we would look at, this is the forecast, this is what you've seen, what can you plant, how can you arrange your activities so that you take advantage of whatever we expect. So really the multi-sectoral and also different levels and types of knowledge have been really helpful in enabling us to reach the really local people.
That's great. And could you speak a bit more about where the investment side of this comes in? So if, let's say there are changed behaviors among the communities because they trust climate information and they're therefore changing their farming practices, is there then an opportunity for investors that see this and think that they can also trust the smallholder farmer, for example, to produce quality food and to add into the value chain?
Yes, indeed. So we've seen already investment in bringing the two groups together, or the various groups together, because in our capacity as government in production of climate information, we don't have the entire capacity to work throughout the entire country. But we've seen support from development partners who enable us to sit together with communities. But also from the community side, we've seen investment from companies that have seen the potential that comes from improved production because of this collaboration, and then they therefore support and organize the farmers so that their yields are improved for the benefit of the farmers and also for the investors.
Great, yeah. Thank you. Does anyone online want to add to Pauline's question? Susie?
Thanks. Just to come back to this idea of cross-sector connections again. The Margaret Pike Trust, who is leading the Ruchiga work, are an NGO that works on this nexus between sustainable livelihoods, protecting ecosystem services, and provision of reproductive health care in particular. And they've been doing a lot of work with conservation groups. So they don't work on health systems explicitly, but of course the protection of ecosystem services and the shifting to sustainable livelihoods interfaces with that. And I think there's a real opportunity to engage more broadly perhaps with actors that we don't normally connect with, like the conservation actors who are very committed through the latest IUCN, International Union of Conservation Nature organizations, committed to working with health in a way that had not been done before. So I think it's bringing these new groups together, having a conversation about how we can mutually benefit each other and how our sustainable livelihoods, ecosystem protection work and health benefits food systems, but that it needs to interconnect with the food systems community. And I think we need to get better at the communication and the cross-working.
Great, absolutely.
Thanks.
Pauline, do we have another question from online?
Yes, unless there's one in the room that you want to take first.
Does anyone in the room have a question to ask or a comment? This is an open discussion, so fairly interactive. Nope, listening intently. Go ahead.
Right, so, oh, sorry, was that a question in the room? I can't see you anymore.
No, not at the moment.
Okay. So then there's a question about loss and damage. Loss and damage is a big topic for this year's COP. And the question is around what do you hope or what do you expect to come out of this year's COP that would help in terms of loss and damage approaches, specifically for building resilience in some of the countries that we've heard about earlier in the presentations.
This comes back to the financing, I would imagine, the loss and damage.
For us and for me, what I'm expecting from this COP is not just commitments, financial commitments being thrown out. If those commitments are still going to encourage the business as usual, then it's still the same thing. So for me, is as we talk about financing, how is that connected to food systems, and what is the financing going to be used for? So I'm looking forward to more commitments towards nature positive solutions, agroecological practices, away from the industrial food systems, which has caused a lot of the harm. You mentioned something about pastoralists, even for livestock production. Data has shown that they are not the biggest problem. The problem is the industrial production of livestock, to cut down trees in order to produce feeds for cattle, and then humans will then eat that cattle, and that puts pressure on the land. So for me, I'm hoping that as governments and private sector and philanthropy make commitments, that they're making commitments towards nature positive solutions.
Absolutely.
Yeah.
Go ahead, Marco.
Yeah, one thing that came out of our analysis on cost of diets is that at the moment, any healthier and more sustainable diet is basically not affordable in lower income countries. So I think one good use, if there were some loss and damage funds or general climate funds, would be to basically put them into food system investments that would make healthy and sustainable diets more affordable. And so there is a clear investment need that would benefit not only reducing greenhouse gas emissions at a global level, but also improving local livelihoods by improving health.
That's right. Do we have any other? Yes, we have a question in the room. Let's pass the microphone really quick. Thank you.
So, to the point about beef and dairy and land use, while it doesn't apply everywhere, it certainly does apply for a lot of wealthier countries, that governments subsidize grain production in order to feed meat, which makes meat much cheaper than it otherwise ought to be. Now, it seems to be a sensible suggestion. Chatham House came out with a report on this, that we pressurize governments to change their subsidy model to make fruit and vegetables cheaper. And essentially, of course, in terms of just transitions, it may be that the same farmers don't apply. But ultimately, the argument about subsidizing the livelihoods of farmers can still be upheld if you change the subsidy model. So that's just one, in case anyone, I'd like to hear any reactions from the panel. The second is, when it comes to land use, agriculture in particular, and how we use forests, protect them or otherwise, you need a long-term view. And our political cycles are typically, 5 years, if that. If we're going to sort of have a long-term plan, I think as advocates for change, we need to have a long-term framework of what we want that's really, has a vision based on some practical thinking, and it's up to us to then tell politicians what we want and to analyze the vested interests accordingly.
Absolutely.
So that's just, a comment.
Do you mind introducing yourself?
Sorry, I'm Fawzia Rashid. I drive the climate and environment work for the Aga Khan Health Services. So not directly involved in your sector, but clearly it's important for nutrition.
Thank you, Fawzia. Any reactions from the panel?
So when it comes to subsidies, the Chatham House report that basically included some of the work that we did on subsidy reform, and I can only agree. Most subsidies at the moment are not directly coupled to any one food commodity, but of course in the past lots of it has been coupled. So there has been this general pattern for what subsidies are used, and most of them are not used to produce healthy and sustainable food commodities. So you're exactly right. In addition to, I think an important aspect is here there are two routes to reforming subsidies. One is to basically do it in your own country or region. So if you already provide subsidies, then you can choose to change how, with what strings they come attached, so to say. And there we found that at least redirecting half of national subsidies towards the production of healthy and sustainable food groups could be beneficial for health, environment, and the economy. and the economy, that is really a quite new thing there. We found that it could be beneficial for the economy because the workforce would be healthier if you had a more healthy food supply and a more healthy food consumption as a result. On a global level, an important additional aspect is that many low-income countries actually don't provide very many subsidies at all. So in order to allow them to provide, to have a level playing field, more global subsidy reforms would be needed. For example, if countries were to agree, let's say, a percentage of GDP or percentage of population to basically inform the overall amount of subsidies by the relative GDP or population contributions. And there we found that if that were to be done, then also lower income countries could participate in that. But of course, just providing subsidies, the money has to come from somewhere. So there again, some discussions of how this should or can be financed is very important, like from loss and damages or climate change. The Green Climate Fund, for example.
Yeah, to your comment, I acknowledge that there's a need for just transition because people get their livelihoods from livestock production. However, we should acknowledge that and be real that there will be trade-offs, right? And there will be winners and there will be losers. The point here is to try to minimize the impact, but this is, given the climate emergency and the health emergency, this is not a time for incremental changes. As countries, we need to be bold with our goals, understanding and acknowledging the trade-offs and the wins and the losers, and trying to try as much as possible to buffer the effect. And also to your comment on land use, I acknowledge that the political cycle is short, and that's one of the reasons why we are encouraging countries to put these plans in their NDCs, because NDCs don't just come and go with every government. And if it's written in fine print because a country is a signatory to the Paris Agreement, then it's more likely that the next government is going to continue with what was included in the plan. So that continuity needs to be there, and acknowledging the trade-offs and making very bold commitments, because there's no time for incremental changes at this time.
Absolutely.
Thank you.
There's also trying to consider the validity of these NDCs, which are the nationally determining contributions. A lot of countries this year didn't update their NDCs and submit them before COP. So really, how much value add does the NDC have for a country? And how are they put into practice? That's a whole other discussion, of course. Is there anyone else on the panel that has anything to add to that question or comment from the audience? I'm also curious, Walid, if you could weigh in from your perspective in Egypt, if there's any linkages with policy or things that you can comment on from the discussion. Oh, you're muted. Walid, you're muted.
Unfortunately, not yet. Let's talk about the agriculture in Egypt. 85% of farmers are smallholder farmers, with very limited access to finance and with very limited access to banks because of collaterals and everything. So finance is a very important issue here. I think financial is a very important issue, and the government and policies have to take this into consideration, but not yet.
Right. Thank you so much.
Thank you.
Are there any other questions? Yes, Fazia has another question. Pass the microphone.
Sorry, I can't resist this one. You know, in terms of our seemingly wedded commitment to growth, so dissenter here, the one thing, I know the population is a super tricky subject, and no one wants to suggest who should do more on that agenda. But I would say as a health advocate that we really need to, at the minimum, discuss and get behind making sure that every woman who wants contraception has access.
Right.
And, you know, I just cannot believe that today it's still something like only 25% of women of reproductive age in sub-Saharan Africa have access. That doesn't mean get, I mean, that is ridiculous.
Yeah.
So given that we have such scarce land resources, all resources, and they're going to get scarcer, can we please at least come together on this one strategic point that it really does matter?
Absolutely.
Thank you.
Thank you. And actually, Susie, that reminds me of what you had discussed in your project in Uganda, if you have any comment to that comment.
Yes, thank you. I mean, that's a totally critical and central question, I think. In the Rutiga project, the Margaret Pike Trust and their partners with the local hospital were trying to increase access to quality family planning because it was asked for. In the baseline findings, women were very clear that they understood that it was unwanted pregnancies and fertility that was giving them more children than they actually desired, that was a direct contributor to pressure on land and poor and insufficient food. And so they were asking not just for family planning, but for quality family planning. So there were some issues around the implants, which were a particularly favoured method. It was easy to get them put in. It wasn't easy to get them taken out. So actually, one of the things the project has been doing has been training medical staff to remove implants, because that increases trust and in family planning, and it gives it a better, more people want to use it if they know that they can also get it removed when they want to. So it's not just about pushing family planning out there, it's pushing rights-based family planning out there. But as you say, it is meeting a basic human right and a basic need. And that is why the Margaret Pike Trust was partnering with these not usual partners in the conservation sector to reach communities that the health sector finds it very hard to reach. So these are, if you like, last mile communities. So I think we need innovation, and we certainly need support from climate financing. Health, and particularly reproductive health, has been under fire for many, many years, and resources have been consistently cut to funding programs like that. And we are seeing it as an integral part of adaptive climate change. And I think it's critical that we don't hide behind the sensitivities, but that we actually recognize that women are demanding this, and we have an obligation to provide it.
Thank you so much. And with 1 minute left, Pauline, if there's any other wrap-up question online that you'd like to ask for discussion?
Well, there are lots of questions. I'm not entirely sure they qualify for a wrap-up question. So if you prefer to ask the panelists some last thoughts on what they would like to come out of this year's COP, that might be a nice.
That'd be great. Yeah. So final thoughts on this year's COP related to the nexus. We'll start with people in the room, if that's all right. Patricia?
Thank you. Yes, so it is critical that we build resilience, particularly for the most vulnerable in our communities, and science has shown most of those are in Africa. And so for us, for me, particularly multidisciplinary approaches and bringing everyone to the table, locally led research is where we need to be going in enabling communities to improve their resilience. And also from the governance perspective, from local government and even from international agreements, we should be able to support the local communities. I think we are on the right track with what the discussions that are going on, but there's still definitely room for more.
Of course. Thank you. Vivian?
For me, as I said earlier, is greater and better finance, not just about the amount, but what is the money going to be put into.
Yeah.
Yeah.
Thank you. In online, does anyone want to jump in first? Go ahead, Walid. You're muted.
Yeah, for me, it's to connect all the dots and make all the value chain actors work together, and following a market system approach, including private sector and government and other value chain actors. And we have to focus more on climate finance.
Yes, thank you. Marco, do you want to go next?
Sure. What I would like to hear at the COP is a greater emphasis on dietary change and the contribution of diets, which can both have big implications for climate change mitigation, but also, if done proactively, for climate change adaptation to shield from any adverse impacts that climate change can have on food systems.
Great, thank you. And Susie?
I think a greater financial and political commitment to new kinds of partnerships to support integrated cross-sector programming.
Yeah, absolutely. And Pauline, do you have any other final thoughts?
No, other than that I'd like to thank the speakers a lot for their inspiring presentations and all the nice questions online, and apologies for not getting to all of them within the hour.
Yeah. It looks like this requires further discussion. So once this session ends, if you'd like to approach the panelists or you'd like to ask them a question, you can come to me. We can connect you if you have any specific questions. So thank you for everyone in the room and online for joining. And good luck at the rest of COP. Enjoy your sessions. Thank you so much.